Hi everyone, Dr. Nemechek here. My patients come in quite frequently. They're taking different supplements. So somebody did some testing, they got zinc and they need vitamin E and they need this and that. And they're all about these antioxidants and stuff like this. And I want to just go over really kind of what's going on. So if you go back to the 90s, there was, in medical science, they were talking a lot about antioxidants and this oxidative stress. And so people were needing vitamin E, vitamin C. And then later in the 2000s, it kind of morphs and becomes more involved, like, wow, the mitochondria, these are components in your cell that convert ATP and sugar into oxygen into energy. And so, the mitochondria aren't working well. And now here in the more modern era, we're understanding that all this stuff that we're seeing is really a function of chronic inflammation that I talk about a lot. Okay, so just going to go over this real quickly. So when you have chronic inflammation, the cells are under a lot of stress, and they produce a lot of what I call ROS, reactive oxygen species. These are basically damaged oxygen molecules that can harm the cell. And so we have things in our body called these vitamins and certain ingredients that will take care of that problem, will fix this. Well, if you have ongoing inflammation and it's high enough, what happens? You start getting deficiencies of these supplements. So that's where, if somebody's talking about you got glutathione deficiency or your vitamin E or vitamin C, these are little problems that are developing. Now, this is not the problem. The problem is the inflammation. These are like you have a dam that's starting to leak. So and what they're doing is, here's some vitamin C, plug the hole. Vitamin E, plug the hole. Glutathione, plug the hole. You aren't dealing with the problem. The problem is the water on the other side, or in our case, the chronic, persistent systemic inflammation. That's what these things mean. You don't treat these supplement problems, you go after the inflammation. Okay? If you just keep plugging leaks in a dam, it's eventually going to bust until you have the problem. Now, so you've got those. Then, in terms of other nutrients, you're going to see here B12, folate, vitamin D, magnesium, zinc, selenium, some of the omega-3s. These are all needed to deal with chronic inflammation. Okay? And again, and there's more data here, like with vitamin D. Everybody's like, taking vitamin D. Taking vitamin D doesn't really help you. Low vitamin D is telling us you have chronic inflammation. You got to deal with the chronic inflammation, because it's the chronic inflammation that's going to give you a heart attack, diabetes, or trigger cancer, not the low vitamin D. Okay? So when you're having these things, you got to think, deal with the inflammation. Don't plug some more holes in the dam, because the dam's giving way because there's too much stress. Okay? And then here, when they talk about mitochondrial dysfunction, okay, same thing. They're doing different tests. Oh, your mitochondria don't work. Okay? That's from the chronic inflammation. You don't take things just for mitochondrial dysfunction. Okay? You got to deal with the inflammation. Where's the primary source of inflammation? Leaky gut. That's your number one source. Okay? Then you have from the vegetable oils. I talk about this with olive oil. Okay? Extra omega-3s from the fish oil, which help reduce the inflammation. Vasostimulator if you need. Okay? And then just so kind of overall, you have chronic inflammation. This is what causes increased reactive oxygen species. Those are those damaged oxygen molecules, depletion of antioxidants like vitamin C, vitamin E, zinc, and gives you oxidative stress. What do? You get rid of the inflammation. And then if you have low vitamin C or low vitamin E levels, it reverses. It'll go back to normal. Okay, without a supplement. You have the high nutrient turnover, like I was talking about, B12, or like vitamin D is a great example. Your vitamin D is low, you got chronic inflammation. You got to work on chronic inflammation. If you take vitamin D and you just artificially elevate that number, it's not doing anything for your health. Okay? It's the inflammation that's going to kill you, not low vitamin D. And then the oxidative stress in the mitochondria. Okay? Mitochondria don't work, no cells will function correctly. Okay? So all these levels and these tests and these supplements people are selling you, they don't help. And the studies show one after another, they do little to nothing to help. You've got to lower the chronic inflammation. And then you don't even need to treat these things. And they will normalize. Okay. Don't get hung up on the vitamins, supplements. Don't get hung up or impressed by all that little testing these docs are doing. Focus on the inflammation. All right. That's all for now. Everybody have a great day. Remember, hit the subscribe button. Thank you.